monster was insatiable, how insurers exploited Medicare for billions. The subhead says most large insurers in the program have been accused in court of fraud. And they go through the list. United Health Group, which has 27% of the Medicare Advantage market, has been accused of fraud. Humana, which has 17% of the market, has been accused of fraud. Or has been, has been accused of fraud. CVS Health, which has 10% of the market, has been overbilled, according to the Inspector General, has been overbilling. Elevance Health, 6.5%, accused of fraud by the U.S. government. Kaiser Permanente, accused of fraud, both by whistleblowers and the U.S. government. They have 6.1% of the market. And, you know, it continues. I mean, Blue Cross Blue Shield, Cigna, Highmark, Scan Group. The Reed Abelson and Margot Sanger-Katz start the article. The health system Kaiser Permanente called doctors in during lunch and after work and urged them to add additional illnesses to the medical records of patients they hadn't seen in weeks. Doctors who found enough new diagnoses could earn bottles of champagne or a bonus in their paycheck. Anthem, a large insurer now called Elevance Health, paid more to doctors who said their patients were sicker. And executives at United Health Group, the country's largest insurer, told their workers to mine old medical records for more illnesses, and when they couldn't find enough, sent them back to try again. Medicare Advantage, this is how Medicare Advantage plans rip us all off. Medicare itself operates on a 2% overhead. 98% of the money that Medicare spends goes to paying for your needs if you're on Medicare. Medicare Advantage, not so much. It varies from 60 to 70% of the money that they get goes to care for you, and the balance of it goes to pay for profits and CEO salaries and nurses to try to upcode you and people to try to reject your, you know, every time you need something, you've got to get it pre-approved, which is not the case with real Medicare. No pre-approvals are necessary. Journalist Natalie Scher talked about this. Privatized Medicare plans cherry-pick healthier enrollees, fudge medical records to make them look as sick as possible, coax doctors into tacking on extra sham diagnoses to bill for, and pay themselves a profit on top of it. Medicare Advantage should not exist. And this, they note, according to the Times, Medicare Advantage was created by congressional Republicans. What a surprise! Matt Brunick, who founded the People's Policy Project, he says, the notion that private insurers would provide more benefit for less money than traditional Medicare while taking a profit is insane on its face. And then, I mean, you know, some of the really shocking stuff, for example, the overbilling alone could have provided hearing and vision care to all Medicare beneficiaries. Just the money that these companies stole from you and me. Just the overbilling could have provided hearing and vision to all Medicare beneficiaries. But part of the big problem is that 80% of U.S. House members, including Democrats, are getting money from the insurance industry. 80% of U.S. House members signed a letter earlier this year saying, yeah, we want to protect Medicare Advantage. Richie Neal, the Democrat who is the chair of the House Ways and Means Committee that has oversight over this, received $3.1 million from the insurance industry, the most in the House of Representatives. We are looking at an insanely corrupt system here.